I want to ask you to question certain things. What is the cause of the problem? Is the cause the problem, or is it the effects of the problem the problem? You see, the cause may be either environmental or maybe genetic. If it is environmental, then we can prevent it. But if it is genetic, we can control it. And it's a combination of both environmental and genetic problems that occurs in the non-communicable diseases that we have at present. You see, the effects of chronic diseases can be prevented. However, it is the price that the developed world is paying for progress. These diseases have been on the incline for the past 30 years. Their incidence have increased as well as their effects. The Director General of the United Nations states, these diseases hamper the people and their economies, even more so than infectious diseases. The Director General has stated that it is akin to a public health emergency in slow motion. The Caribbean has not been spared. Although CARICOM member states enjoy a reasonably good life expectancy, the major causes of mortality continue to be dominated by chronic non-communicable diseases such as heart diseases, cancer, diabetes, CVA, strokes with hypertension as comorbidity. Diabetes is now considered an epidemic in the region, and its complications are mainly vascular, further contributing to stroke, coronary heart disease, kidney failure, and peripheral artery disease. Amputations are somewhat excessive and further add to the human and economic cost to our country. Does Trinidad and Tobago situation mirror its CARICOM counterparts? The statistics indicate that the top 5 causes of mortality in Trinidad and Tobago are cardiovascular diseases, cancer, diabetes, accidents and injuries, and cerebrovascular diseases. The prevalence of heart diseases in Trinidad and Tobago is twice that found in North America. The diabetic prevalence rate in the population is approximately 12 to 13%. When combined, heart diseases, cancer, diabetes, and CVA, they account for 60% of all deaths. In 2004, the public expenditure on pharmaceuticals for the treatment of cardiovascular diseases, diabetes, cancer, hypertension was approximately $34 million. In 2009, 5 years afterwards, it was $120 million. And between 2004 and 2009, the public expenditure on these drugs increased over 250%. At present, it's almost about $400 million being spent on pharmaceuticals. What has been even more alarming for us in Trinidad and Tobago has been the emergence of the chronic non-communicable diseases in our children and youth populations. The 2010 survey of BMI Body Mass Index, conducted by the Caribbean Food and Nutrition Institute for the Ministry of Health, revealed that childhood obesity is on the rise in Trinidad and Tobago. Approximately 1/4 of our primary and secondary school-age children are overweight or obese. Further, a school-based diabetes screening project conducted by Professor Tilakson, who is here with us, has further revealed the existence of type 2 diabetes, often referred to as adult-onset diabetes, in school-age children. Overweight and obesity are a risk factor for this type 2 disease. There are indicators that the chronic diseases epidemic will worsen unless critical, preventive, and health promotion actions are taken urgently. Sir George Ali, United Nations Secretary General, Specialist Envoy in HIV/AIDS in the Caribbean, summarized the problem. NCDs hold back economic growth, but NCDs also impede your potential and ability to make a living. NCDs impair human development, they impair economic growth, and they impair educational potential. Surely then, you would agree with me that this National Symposium is of great significance. Our children are the future of our nation. They are the ones that must take up the mantle and take the national development forward. It is therefore our responsibility, and we must do everything we can to ensure that they have the health and ability to do so.